People say in the United States, oh, those Canadians, they wait a long time for health care.
In the places that have a single-payer system, Canada just to our north, people die waiting in line.
No, they don't.
No.
No, they don't.
We deal with an issue that is a real issue in the United States, by the way, and that is waiting times. Is that a problem for certain types of procedures in Canada?
Did you feel like you got the surgery when you needed it?
Yes.
So you feel like you got the care you needed, you got the surgery
definitely got the care I needed.
when you needed it?
Yes.
We're very conscious right now about the issue of wait times for certain things. Shortly waiting for cataract surgery, for certain types of diagnostic imaging tests.
I've been to the emergency room, and yes, I've had to wait a couple of hours, but I also know that, for people who are really in danger, they are seen immediately.
They create a queuing system.
That's right.
And instead of giving everybody care and innovation, they create a line, and if you wait too long in line that you happen to pass away, that just is part of the way the system works in Europe and in Canada.
I had 28 rounds of radiation this summer once I was diagnosed with cancer. There was no waiting.
The lines and the waiting time was what happens around the world with government-run insurance, and we see that in Canada.
I got the surgery when I needed it. I was very happy to be able to come in an orderly time.
Overall, right now, I don't think we have a wait time crisis at all for important care and necessary care, and when people are sick, they get treated right away.
When Canadians are seriously sick, they get the care that they need and they get it right away. That is reflected in the fact that our outcomes are as good or better as the United States for a wide range of acute and chronic issues.
Most people I know do get seen in a timely fashion.
Patients often wait in pain.
If it is an emergency, then you get seen very quickly. Of course, if it isn't, you are going to wait a little bit. And I think that's not unreasonable, actually.
What you're arguing, tell me if I'm wrong, is that waiting lines, at least here in Ontario, are not a major problem. That's an issue that you can deal with.
Yes.
This myth that Canadians are dying on waiting lists because they can't get access to important and urgent care is a myth.
People die waiting in line.
Having said that, we do have challenges with respect to what we call elective or non-urgent procedures and specialty appointments, and that's something that we're working on. It's our belief that within a single payer system, it's actually easier to address those challenges because we can reorganize the resources that we have in order to make them more easily accessible to people. It's actually harder to do that when you have multiple insurers in the mix.
Canadian healthcare system is not perfect, but I think there are just a whole lot of very intentional lies and distortions. These are not misunderstandings.
People in Canada routinely wait months for procedures Americans can get in a matter of days, if not hours.
These are very intentional lies in order to try to convince the American people that the current dysfunctional system we have is the best that we can do.
Cardiac care in Ontario, our wait times are extremely short. Dr. Rubin will tell you what's the wait time if a patient needs an urgent cardiac procedure here.
So at this hospital, it's 0 days.
Months and, in fact, years-long waiting lists.
And across the province, it's 1 day. And that's because we've been able to organize all of cardiovascular care. So if somebody is going to wait at one place, they go to a different place.
And I would say that in the United States, we just don't record the wait times. And so we have no way of tracking the wait time. We have no idea how long people wait to get care they need, especially if it's based on their ability to pay.
I want to pick up that point. Do you think that in America, people say, oh, I think I need surgery. I'll walk in tomorrow and get surgery. Or I need to go to my general practitioner. Oh, I'll walk in and get an appointment this afternoon. That doesn't happen in the United States.